Hello, welcome back to Dr. Hayatu's medical session. Today we'll be discussing head injuries. Before we begin, don't forget to hit that subscribe button and ring the notification bell to stay updated on our health content. Head injuries are a significant concern in both emergency medicine and trauma care. They can range from minor bumps and bruises to severe traumatic brain injuries that can have lasting effects. Understanding the various aspects of head injuries, including their risk factors, symptoms, and management, is crucial for effective treatment and recovery. Several factors can increase the risk of head injuries. Age. Children and older adults are more susceptible to falls, a common cause of head injuries. Participation in contact sports, football, boxing, hockey, and other contact sports carry a higher risk. Motor vehicle accidents. High-speed collisions can result in significant head trauma. Violence. Physical assaults and gunshot wounds are potential causes. Alcohol and substance abuse. Impairment increases the likelihood of accidents and injuries. The symptoms of a head injury can vary widely depending on the severity of the trauma. Common symptoms include headache, nausea and vomiting, dizziness and loss of balance, confusion and disorientation, loss of consciousness, bleeding from the scalp or face, clear fluid, cerebrospinal fluid, leaking from the nose or ears, bruising around the eyes or behind the ears, known as battle sign, and pupillary changes such as unequal pupils. Diagnosing a head injury typically involves several key steps. First, this includes a thorough history and physical examination with a particular focus on neurological assessment. Next, we move on to a CT scan is often considered the gold standard for detecting fractures and acute bleeding. An MRI, on the other hand, is useful for identifying more subtle brain injuries, especially in the subacute and chronic stages. Finally, is crucial. This involves monitoring for any changes in symptoms over time, particularly in the first 24 hours post-injury. Indicators of a severe head injury include persistent or worsening headache, repeated vomiting, seizures, slurred speech or weakness in limbs, increasing confusion or agitation, and unconsciousness. A basilar skull fracture involves a break in the bones at the base of the skull. This type of fracture can be particularly serious due to the proximity to the brainstem and cranial nerves. Signs specific to basilar skull fractures include raccoon eyes, also known as periorbital ecchymosis, battle sign or mastoid ecchymosis, CSF rhinorrhea, which is clear fluid from the nose, CSF ottorhia, which is clear fluid from the ear, and cranial nerve deficits. The management of head injuries, particularly basilar skull fractures, includes airway management, ensuring the patient has a patent airway, breathing and circulation support, providing oxygen and intravenous fluids if necessary. Urgent evaluation by a neurosurgeon may be required. In a hospital setting with frequent neurological checks, analgesics for pain relief, anticonvulsants, if there is a risk of seizures, antibiotics to prevent infection in cases of open fractures or CSF leaks, may be necessary for depressed skull fractures, significant hematomas, or persistent CSF leaks. Head injuries can be complex and multifaceted, requiring a comprehensive approach to diagnosis and management. Early recognition and appropriate intervention are key to preventing long-term complications and ensuring the best possible outcomes for patients.